Interestingly, you were part of the creation of the commission. It would be interesting to know the exact mandate as we roll into the 1 year in office of the state government, right honorable Sheriff the exact mandate he gave to the commission this time.
Yeah, you are right. I was the member of the technical working group that put together the bill that became law of this commission. Actually, one of the heads of that technical working group. The mandate was clear: implement and regulate a health insurance, social health insurance in Delta State, and in a more clearer term, ensure that all residents of Delta State are registered into the social health insurance scheme to receive quality care without anyone being left behind. If you are in the rural area, hard to reach area, you have no money, everybody must be taken along. So it's a very clear mandate. Enroll all the residents of Delta State into the health insurance scheme. In other words, achieve universal health coverage in Delta State as within the next few years. Actually, the WHO mandated all countries to achieve universal health coverage by the year 2030. And I think Delta is determined to even achieve that before that date.
Besides the proliferation, I wouldn't say proliferation, interestingly, Delta State is one of the most education advanced states. We have multiple higher institutions. We've seen your commission go into relationship with these institutions. Shed more light on this.
Before that, let me just quickly run through the plans and initiatives of this commission. The law created 4 plans: the equity health plan, the informal health plan, the formal health plan, and the private health plan. These plans, the equity is actually meant for the vulnerable people, those who cannot really afford to pay the small premium of 7,000 naira, and those who are endangered. For example, pregnant women. All pregnant women in Delta State, from the day you are pregnant till you deliver, either by spontaneous vaginal delivery or by cesarean section, it's free. And the government pays for it. Of course, there's no free food in Freetown. So it's free to the enrollee, but the government pays, and that's a huge bill. And the purpose of that to ensure that our indices in maternal mortality is greatly reduced, and no woman pregnant in Delta should die in pregnancy, should have any morbidity in pregnancy. That is why. We also take care of every child from 0 to 5 years, with the critical period where children are prone to deadly illnesses, and of course the old and the challenged, physically and mentally challenged, the equity health plan. For that, we have registered well over 1.7 million Deltans. And then the formal sector has to do with the employees of the public and private organized sector, and that all Deltans who are civil servants, public servants, are already enrolled automatically into the scheme from day one. And then the organized private sector, a lot of companies, if I say rule in Delta now, before you contract with Delta State, you must register your staff with the commission and have a certificate of clearance before you can do any business with Delta State. And so the organized private sector is coming in. The informal sector have to do with the artisans and every other person that is not in this group I've described. And we are doing a lot to ensure that one comes in. But apart from the basic plans as entrenched in the law also gave us the mandate that we can create other initiatives to ensure that we cover everybody, all Deltans. And so we have initiated about 3-4 other initiatives. One, the indigent early adoption initiative, the artisan early adoption initiative, inducement initiative, And then we have the T-SHIP. The T-SHIP is Teacher Institution Social Health Insurance, Student Social Health Insurance program. That had been, is actually a program initiated by National Health Insurance Authority many years back, but it's hardly worked in most states. Even the federal government couldn't drive it in universities, federal universities. But in Delta, we did a rethink and redesign of that program. And with that, we're able to convince the universities, and they are enrolling MAs into the scheme at the moment. You saw the flag off we did at there's a university where about 4,000 students were enrolled, and then University of Delta, Unidair at Agbon, where more than 8,000 have been enrolled. And other universities are coming and polytechnics. And the reason they are now interested is the redesign. One, the student will receive care from their clinic in the university, which we will ensure that is very standard. Of course, we're going to pay capitation to them, and that capitation, part of it we use in upgrading the health facility in the university to a level that the student will be happy to attend there, because sometimes the environment of a hospital discourages people from attending. So that is number one, redesign. Second part of it is that the student on holidays can receive care anywhere in the state. With the ID card, they walk to any hospital, government or private, registered in the scheme, we will pick up the bill for them. So on holidays, in campus, outside campus, in the state, they will get care. We also went further. We've discussed with our colleagues in other states to ensure that those students who are in Delta pay their insurance premium in Delta, but they live in Lagos during holidays. They will also be able to attend a hospital registered in Lagos State Health Insurance scheme, and then the bill is sent to us to pay. So we made it very robust for the student that anywhere the student is in Nigeria, it will be taken care of. And this really encouraged the student unions, the university authorities, and it was an automatic success. Because you need to repackage your processes for people to, your product. You know that people repackage products in terms of other things they sell. In insurance, you produce a product and then you sell it. And I'm sure that is why that scheme is coming in. Delta has a lot of universities, a lot of institutions, and all of them are coming. Actually, by the next section, virtually all of the universities will come in. Because they have some arrangement prior to this new initiative, they've asked us to just give them a time to reorganize themselves, and they will come into the scheme. So again, the indigent adoption initiative is gaining ground so seriously, because we appeal to Deltans of what? To help us look after the vulnerables around them. Everybody, me and you, we have vulnerable members in our family. Probably one or two rich persons in the family, but there's a lot of people that need help. And we did appeal. A clarion call was placed in the system by me, and a lot of people have been purchasing health insurance for the vulnerable. In fact, in Onitsha, where 100 was purchased, they just called me yesterday that they have 400 have been ready to enroll into the scheme. Another area in Delta Central, 700 have been penciled down, paid for to come into the scheme. So it's gaining wide acceptability, and people, I'm sure that before this year runs out, our determination to enroll 1 million lives into this scheme will be achieved.
As we pull the drones back home, it is one thing to see most of these activities going to full gear. How much of political will, how much of encouragement would you say you received from the governor to get most of these things stretched out?
Without the political will, health insurance cannot work in social insurance. State-run social insurance cannot work. And so that we have gotten this so far means that there have been a strong political will. Political will is not something you can grab and see, but you see the effect. That regularly we get people enrolled in. We got funds to pay for services rendered. We have funds to run the system here, mean that fund is being released to us. And it's only a political willed system that releases funds to an agency. And so that is there. And I wasn't surprised, and I'm not surprised, because the present governor, Right Honorable Sheriff Oborevori, was the speaker, was a member of House of Assembly when this law was passed. And he has been defending and supporting the system even before he became a governor. When he was a speaker, he did a lot to support us. So I wasn't surprised that when he took over, the goodwill of the former governor, Senator Ifeanyi Okowa, continued. And I will tell you one of the signs of goodwill, political goodwill and force. Reappointing my honorable self from the chairman to go and come and sustain the system is a sign that you want the system to survive. Instead of bringing a brand new person, say no, Dr. Akpoveta, come and stabilize the place, come and sustain the place. And so that is very important. It's a sign that he's determined to ensure that this place works. And since I came in, I've been very supportive, financially, politically, advice-wise. And so I must thank His Excellency the Governor for his effort to ensure that Deltans, the more agenda is very clear. He wants to do more. Symbolically represented, want to do more for Deltans. And what is more than good health for people? So Sheriff cares. He cares for Deltans. He wants to ensure that Deltans get good health and quality health care in the system. So there is a lot of political goodwill from the government.
It is often interesting when we hear most of these things in the news. Is it possible you add figures to how much you've inducted Deltans into the program?
Yeah, thank you for this question. Delta is number one in all the scores of health insurance in this federation. We are the first to start statewide social health insurance. In other terms of achievement of the scheme, we are number one. But most importantly, the key factor in health insurance is number enrolled. By today, we have enrolled well over 2.2 million Deltas into this scheme. And more importantly, about 1.7 million of them are vulnerable people. In fact, it's because of the vulnerable people, really, you create social health insurance. And we have gotten about 1.7 million of them. But in total, we're about more than 2.2 million Deltas into this scheme. Number one, any other state is below 1 million as of today. You can prove me wrong, but I know that figure because every month we submit our release numbers to the National Health Insurance Authority. So we know what we have in every state. So we've done very well. Deltans have accepted, and that's about well over 30% of Deltan population. So we are going to 80%, and that will become universal. And it will be self-sustaining by then. So we've done very well, and we are seeing, in fact, the numbers are coming faster than before because people have now accepted the scheme, they are enjoying it, they appreciate it, and as such, people are voluntarily registering, people are voluntarily adopting people and paying for them to receive care. And with that, again, we did something that is very unique. It's only in Delta we have what we call the Access to Finance. The Access to Finance was a project between Bank of Industry, Farmers Access Foundation, Delta State Health Insurance Commission, and Credit Fund, where we pull funds together and loan it to private providers who had a PPP, public-private partnership with us, and went into the rural, hard-to-reach areas, in the riverine areas, and opened up moribund health facilities built by Shell, Chevron, philanthropists that were not functioning. We took them up. Out of 25, we have been able to activate 18 of them in areas where you need to take a flying boat for 4 hours before you can get there, where they have never received care in their life. We took health care to them. And so it's a world acclaimed initiative that even recognized by United Nations, by WHO. And it's being adopted now as a model for the Niger Delta 9 states. And so very soon you're going to hear about access to finance initiated by Delta State, now becoming a national, regional, and a national condition initiative. And we are proud. We win awards in all these issues. Well over 4 awards from different national and international organizations for performing well. And I think the Delta is proud of that, and the country is proud of Delta State. Thank you.
Yes, sir. It is said that what gets measured gets done. Are there infrastructures in place by the Commission to ensure that these UN enrollees get the needed care they demand from those, and ensuring that people do not just...
We've accredited about 522 health facilities. Recently increased to about 540 health facilities across the state. We don't just take any health facility. We go there, assess it, and accredit it. Where I will say that service provision still has some limitations. And this is because a lot of health resource for health, human resource for health, is depleting in Nigeria. A lot of them have traveled abroad for general practice to have constraint of number of the ratio of health workers to population is very high, and that is causing some constraint in the system. But I'm happy that the governor, the minister, the commissioner for health, even the national level, if you read the paper only yesterday, the National Assembly have decided that they have to do something about reducing number of health workers in Nigeria. And the state is doing something, it's employing every day, there's employment of health workers. We held a meeting just only yesterday to ensure that we look at the challenges in the sector, in the service side. You know, we have the demand side with the health insurance agency, the service side with the hospitals and health centers. We are working on that seriously, because without that, the system will have some more challenges, and want to reduce that challenges, and government is aware of that. We are also supporting that to ensure that we have a seamless attendance to our enrollees in the system.
What would you advise to Deltans who are targeted or who might have understood the good news and the duty to inherit what the state is doing with the Health Commission?
I think for those who know, first they should go and tell those who have not heard about it. I've come to realize that no matter how loud you scream, some people won't hear you. But a lot of Deltans are aware of this scheme. I want to appeal to them to talk to their neighbors, their friends, their families, that there's something good happening. And it's so cheap because it's subsidized by the government. And that's the Delta State Control Health Insurance Commission. Let all Deltans ensure that they register into this scheme. It's very, very important for them, because health is wealth. You can't do without health. You can have all the money in this world, and if you don't have good health, you can't enjoy it. And government has put in place a system and to give you good health with minimal cost. In fact, a lot of it free. So no woman in Delta, pregnant, should go to any hospital without going to the hospital where you can receive social health insurance, to get registered and take care of it. Every child should get enrolled into this scheme so that we can protect them from sudden illness that can become fatal to them. In summary, all Deltans should voluntarily come and register into the social health insurance scheme of Delta State, as supported and promoted by the MOA agenda of Sheriff Oborevori. Thank you.
Thank you so much, sir, for giving us this time. We look forward to having more of these conversations with us, time permits.
Thank you too. I appreciate your
Thank you, sir.
Your coming to talk to us.